Hi, in this video we'd like to come back on the Hyperemesis Gravidarum topic again with two major updates if you have been following our channel. So the previous update was, which is the first point, which is we are no longer doing Hyperemesis Gravidarum remote treatment. And you can find out more information on that video, but because of multiple reasons, with conflicting patients not listening to our instructions, patients asking us to reimburse them even after giving them the full treatment, patients who are not willing to take the treatment once they see that it's an injection because there's fear and anxiety. Several reasons we have decided to shut down for the time being the home treatment option for hyperemesis gravidarum. So from today onwards, we are strictly requiring all patients to receive the treatment in the hospital physically. That means you need to come to the hospital and be present to receive our HG vaccine. Now, the second important update is that today we'd like to announce that there's a new protocol, and it's not really a new protocol because a lot of patients are confusing on how much the exact dosages are required for our HG treatment. So you will need at least 15 injections of our HG vaccines to see full recovery with no recurrence, no symptoms, and then only you can go home. Now, this 15 vaccines is the lowest amount that you will need, and one injection per day for 15 days. So for this 15 days, you will need to stay in the hospital. You cannot be leaving the hospital after the injection and then coming back the next day, because we want you to be monitored and we want you to be stabilized. As we all know, hyperemesis gravidarum is a drastic and also potentially life-threatening conditions. We cannot take that risk. You will need to obediently listen to the doctor and nurses and just stay for that 2 weeks. One injection per day for 15 days, and you will see full recovery and zero recurrence. Now, this 15 minimum amount of vaccines is required because many patients, even though they take half of that amount and they already see symptoms subside, they can sleep and eat and drink. However, lower than 15 amounts, in our observation, we've seen that it's commonly lead to recurrence, which means when they go home, the symptoms start to come back again. And then at this time, patients need to come back to the hospital, spend more money, and then they've already developed a tolerance as well. Then you need more injections to actually have it stabilize. So regardless of your history, you will need to listen to our instructions, and we require you to take at least 15 amounts, and especially effective if there's no symptoms showing yet, especially in the early stages of pregnancy. Take 15 injections and you will basically see zero symptoms in the midst of pregnancy, and you can go home as well. Now, if you want to avoid all that mess of 2 weeks of hospitalization, 15 injections, you can actually choose to receive this treatment before pregnancy. It's much more simple and much more effective. So for before pregnancies, only 4 injections are required. 1 dose per week for 4 weeks, and you can do this at home as well. You can take it back home, and then with our instructions, we will teach you how to do it. You won't need to stay in the hospital for that long. If you do want to stay with Antai Hospital, you can. But before pregnancy, if you receive those 4 HG vaccine dosages, very low amount, you will basically see no symptoms showing up. This entire disease will be eliminated in your subsequent pregnancy. However, you only have 6 months of a window to actually get pregnant quickly. So a lot of people are also afraid that they cannot get pregnant within that month. So there may be a lot of factors involved. You can discuss with us and we can come to a compromise. You can also get pregnant first and then come to the hospital immediately. All of these are tailored to your needs because our treatments are personalized. So this treatment comes with a full refund guarantee and a full contractual treatment as well. So if you sign a contract with the hospital and the doctors, pay the treatment fee, and you will get as much of the dosages as you need, regardless of your severity, and you will not be charged any extra fees at all. These are all things that you can discuss. I hope that you've learned some new information of our new protocol here at Antai Hospital, and stay tuned to the next one. Please leave me a comment down below, and if you're interested in our HG vaccine, if you'd like to seek the treatment, if you'd like to get a personalized treatment plan as well, please get in touch with our consultants and doctors. via the website. We look forward to hearing from you.